Okay, we're here with Rais from Enthea. Hi, Sherry.
Hi, how are you?
We finally did it.
We did.
Yes. All right, so why don't you give a brief introduction about Enthea itself just to get started.
Sure, yeah. So Enthea is a health plan benefits provider of ketamine assisted therapy as a benefit plan. We are the only provider of this benefit, and we basically act as a third-party administrator of health plan benefits so that we can channel employer funding to psychedelic healthcare. And we are doing this to improve safe and affordable access or create pathways for safe and affordable access to psychedelic healthcare.
Okay, very cool. So there are some insurance providers out there currently giving maybe spot coverage. Is that how it is? But you're the first one making kind of plans with employers. Is that it?
Yeah, so there aren't any insurance companies that are actually creating full-on benefit plans that employers can add and offer to their employees for coverage for psychedelic healthcare. Some insurance companies, as you noted, are maybe doing one-off reimbursements for the therapy or for the ketamine, not usually both, but that's in absence of a full medical policy or a provider network or credentialing standards dedicated to psychedelic healthcare.
Yeah, exactly. Yeah, one of my questions was maybe let's describe the current landscape for insurance coverage. Is it really someone needs help, they go ahead on their own, and then they have to chase the insurance company to maybe get covered? Is that the current state of things?
That is the current state of things, and that chasing to maybe get covered is almost always not getting covered. Um, Pretty much almost always not getting covered. What they may be able to get covered if they do things sneakily, let's say, is the
Mm,
therapy portion of their psychedelic treatment. But even that is difficult to get covered. I mean, just in general,
mhm.
health insurance has done a poor job of covering mental health.
Yes. Yeah. Yeah. I may have heard of one friend who really had some severe PTSD, and maybe they were able to get some coverage, but it was not easy enough. Okay, so you want to increase access to psychedelic therapy. Um, and so you're currently, so there's employer benefit plans already out that you've rolled out already.
Yeah, we created an employee benefit plan. We launched our pilot with Dr. Bronner's at the beginning of last year. And now that we've had a successful pilot, we are onboarding more customers this year and actually onboarding customers this month to roll it out and offer it to more companies.
Um, so how would you describe Enthea? Maybe a little bit more. Insurance company? Do you want to describe a little bit more about, what, how do you describe it?
Yeah. So one, the technical term is actually a TPA. So we're a third-party administrator of insurance plan benefits. That sounds like technical language, but most of the insurance coverage Americans receive are through TPAs, even when it's through Blue Cross or United or Kaiser, those entities are acting as TPAs, as third-party administrators of these benefits. So we're operating just like them. But it is an important differentiation that we're not actually the insurance company. And I would also go further to describe Enthea as solving for the equity crisis in the psychedelic ecosystem. It really struck me as surprising and also really sad that most Americans can't afford a $500 unexpected expense. And knowing that on the backdrop of the cost of psychedelic assisted psychotherapy, there's this immediate realization that, okay, well, most Americans we see from this data, most Americans will need access to good mental health care, especially since COVID, but most will not be able to afford it. So I would describe Enthea as solving for that equity problem.
Yeah, yeah, access is going to be a huge issue. Right? We're really focused on, are the drugs going to get approved? FDA trial phases, and funding for these drug development companies. But at the end of the day, all of this is going to be for naught if people aren't able to access these therapies once they get approved. So this piece of the puzzle, especially in the US, is important. So bravo. Yeah, I'm glad you're working on it. I'm wondering, like, how would you see the future of the space unrolling? Is it going to be through the employer benefit package? That's most likely how you foresee things going.
Yeah, I mean, that's how most insurance coverage in the US happens. It's through employer benefit packages. That's how 80% of coverage happens. And that's if we can get that to be included and cover psychedelic assisted therapy, then I think we're making progress in bridging the gap. So yeah, I think that's the future.
And so it was in December you guys announced some news about a seed round to
Yeah,
help expand and launch into markets across the country. Tell us a bit about
yes.
that.
So funding was challenging for us, just given the climate. I think it's been challenging for everyone in this market. We did successfully announce our $2 million seed round, which we raised and closed in December. Um, it was led by Tabula Rasa Ventures. We're really grateful to them. We're also grateful to our other investors and supporters, including Mike Cotton, who is an important person in the space, as well as Mystic Ventures, who are doing a lot in this space as well. We are raising an additional 1.5 million to allow us to grow faster because we're just getting so much demand. So both employers and providers are reaching out to us wanting to offer this benefit to their employees, and providers are reaching out because they want to be included in our network. So we are raising an additional amount of money in the seed round so that we can grow quicker and exceed expectations.
Excellent. It's good to know that there's demand out there. And are you seeing, so you're getting demand from employers as well? Are these only the more progressive kind of psychedelic employers, or you're getting, is it slipping into the mainstream?
You would be surprised. There are, of course, some psychedelic friendly companies that are reaching out, but there are a whole range of companies reaching out from various sectors and various sizes. So we have companies ranging from 50 employees to tens of thousands of employees. Some of those are much larger Fortune 100 companies reaching out to us. And what is often the common thread is a C-suite or a founder has probably had their own psychedelic experience or is curious about psychedelic therapy because of their own experience with the mental health issue. So we're getting a lot of that. It's not in all of the cases, but I would say that is a reoccurring pattern. We're seeing that people are reaching out to us after having their own experiences and wanting to share that and seeing it works.
Yeah, that's how a lot of things get going in the
Yeah.
space. And I mean, it should only continue as the destigmatization increases. You'll probably have more and more executives and decision makers feeling comfortable going in that direction.
Yeah.
Yeah, okay, that's great. Um, and so yeah, I guess you've seen increased access. So actual patient delivery, I guess, is Dr. Bronner's the only one that's actually in the works, working rather than the work.
They're the only ones with patients who are receiving treatment, and we are onboarding 5 more companies this month.
So you're helping increase access. And get
Yeah, and what's really, I guess, interesting is what the data shows on like the potential benefits for these companies. For example, employees with unresolved depression are 35% less productive at work. The number one reason for millennials and Gen Zers to leave their job is for mental health reasons. So there's like profound impacts and benefits for the companies as well.
Right. Definitely. So yeah, there's productivity and there's going to be employee retention and all these other. Yeah, I can't wait. I can't wait till the numbers start really coming out and people start seeing the benefits numbers wise. Besides the health.
Yeah.
Yeah. Okay, well, it's great. I mean, I'd love to see once you announce more clients and your network. I'd love to check back in a little bit and see where you guys are at in terms of building out this project.
Yeah, I'll be excited to keep you updated on the progress. We are planning on opening in 40 cities this year and bringing on board 100, at least 100 customers, if not more,
Mhm.
and bringing in about 80 providers in network. So it's an exciting time.
It is. It is. Okay, yeah, and just like I said, this is a really important piece of the puzzle. So keep at it. Good work.
Okay.
All right, we'll speak soon.
Thanks so much. I look forward to it.